Well, hello, FMCA family. Welcome to our second Facebook Live that we're doing.
Hello, FMCA family.
We have a little issue
Welcome
here.
to our.
There you go. All right. Again, welcome to our second Facebook Live that we're doing to spotlight member benefits. We had our first one last month with Courtney Woogie and FMC RV Insurance. And we're now welcoming in Tim McNichols. He is the Executive Director of Partnerships with LIG Solutions. We thought this is a perfect time to kind of sit down and chat with Tim. Since it is a newer benefit, we launched it in February of 2021. But with open enrollment coming up, we thought it was a good time to get Tim on and ask some questions and kind of clarify this somewhat still new partnership. So welcome, Tim, if you want to
thank you.
Yourself and kind of what you guys do.
Yeah, I appreciate it. Thank you, Chris. Thanks for having us. And we've been thrilled to be partnered with FMCA. And you've had a lot of great conversations with members already since this program officially launched earlier this year. And obviously, with it being open enrollment and annual enrollment period right now, we're having a lot of those conversations. So, just to kind of give a quick overview on who LIG is, we're a national brokerage. We're based out of Cleveland, Ohio. And as a national brokerage, we're not beholden to any one insurance company. We work with really just about every single carrier that's available in the marketplace. And that's important because a lot of what we do and what we've built out with the programs we have for our association and membership partners is the fact that it's about choice. It's finding the right plan for the right situation for the right time for people. And, with what we do, we really only do health insurance. We do have life products as well, but that's our specialty. That's what we do day in and day out is health related coverage options for people. So, we have, these, very good relationships with carriers, but at the same time, when we're going and having a conversation with one of your members, we're going to look at, what their situation is financially, from a lifestyle, traveling. Obviously, your members are traveling a lot, so that's something that it takes into consideration here. And then the financial health side of things and doctor networks, all the little nuances that make this kind of stuff important. So it's not a one size fits all approach on any level, and there's no national solution for. No carrier. There's no one single carrier that works. As far as a national solution, I mean, Medicare is close to being a national solution, but it's dependent on where you live at or what your home base is. Where your permanent address of what carrier options are going to be there. So that's kind of what we end up doing with a member is going through that and figuring out what is the best fit for them based on all those little criteria that we just talked about. So we do a needs analysis. It's really more of a concierge approach that we take with a member in sitting down and understanding, do they need major medical? Is it Medicare? Is it under 65? Do they need things like vision and dental? So supplemental coverages. And, it's really, it can be that finite, get into the weeds, or somebody, hey, I have coverage through a spouse, but all I need is vision and dental. It has that much flexibility to it that we can, peel back and get somebody just what they need, if that makes sense.
Yeah, I think something you said that is important to point out is when we were seeking a partner for insurance, one of the things that really stuck out to me is this is what you guys do, right? I mean, you really focus on bringing these types of benefits to associations, correct? I mean, that's one of this is your specialty, essentially. This is what you guys do, right?
Yeah, we work with right now over 100 different associations and membership organizations, and that list continues to grow. And my background has been the association world pretty much my whole career. So, that's something that that experience of either being an association executive or being an association partner, like I have for the majority of my career, kind of bake that into our program here. And, what we've built out here since this program officially started back in 2018, we've been doing this since 2009, but we had been kind of informally doing it for some of what are now our true association partners. But that's where we really saw that there was a need need. And so that was, kind of that genesis where it started as well as the company. But that's what we do day in and day out, is work with, membership organizations, their members and families and, business owners, if that's the scenario. So, it is comprehensive from that standpoint.
Yeah, let's kind of just go through while we're talking about kind of background. Maybe just a brief history of LIG Solutions. What does it stand for? Kind of where you guys are based out of. Some of those details, so people are a little more familiar with your company.
Yep. LIG Solutions actually stands for Lighthouse Insurance Group. We, as a company, were formed back in 2009. Jason Farrow, who is our CEO and founder, is still actively involved in the company. Actually had grown up in the insurance industry. His parents' family had owned a group brokerage that was based here in Northeast Ohio, which is where we're headquartered. We're in Independence, Ohio, which is just outside of Cleveland, downtown Cleveland, about 20 minutes south of the downtown Cleveland area. And back in 2009, that was right before the Affordable Care Act became a reality. He knew that people would need help. This was a new way for people to be able to get health insurance. He was kind of smart in that way, and saw that people would need that assistance because you could not get health insurance like this previously. Mm-hmm. So he started what is now LIG Solutions back then, and we've grown from that kind of humble beginnings to large national brokerage. We have over 100 employees. Primarily everybody's based out of our headquarters here in Northeast Ohio. But one of the things that the pandemic really helped us do is we all went remote. I mean, most everybody did in some capacity, but we actually have been able to hire some staff that are not here in Cleveland, primarily Medicare and bilingual. We have a lot of specifically Spanish-speaking agents, and we've been hiring those down in Texas and Florida primarily, but we have some staff in North Carolina and Arizona and a couple other places. But that's actually just helped us to expand and bring in some expertise too, that is to the benefit of our members. But as this company has grown and we bring in these new pieces parts, these are the kind of things that we're doing to kind of continue to enhance what we're offering and how we handle this in the marketplace. But we went and we use LIG Solutions for a couple of reasons. Really, that's what we do. And then the other side of it, if you Google Lighthouse Insurance Group, you'll find there's actually quite a few insurance companies called Lighthouse Insurance. And, we were getting into some scenarios. There's a large, I think, auto insurance company up in Michigan that has nothing to do with us, but we would get calls for them a lot. And it just, we went and decided back last year to officially just do everything under LIG Solutions for our company, for our members. It had been what my business unit, which is what we do here, had been LIG Solutions from the start. We do it now as the whole entire company.
Yeah, one of the things you said that kind of caught my attention is you had mentioned that you work with associations because you give people access to coverages like medical coverage that they couldn't get on their own. What's the advantage of going with LIG versus just going out on your own and trying to find an insurance policy?
Well, part is, this is what we do day in and day out. I don't know about you, but I don't do my own taxes, partly because I find it rather confusing. And if I did my own taxes, I'd probably end up going to jail because I wouldn't do them right. But we have a staff here that, this is what they do, again, day in and day out. We have access to really just about every single carrier that's out there, every product. And if someone was looking, if they were under the age of 65, for example, and they were looking for coverage and they went to their state or federal exchange, depending on where they're at, they're only going to have access to the plans that are on that exchange. There's quite a few plans that are called off exchange plans that you can't get on your own going to the state exchanges or the federal exchange. There's also other options that are not part of the ACA that can be really good coverage options. And those are considered like short-term options, and there's some other direct-to-carrier options that aren't part of the ACA that for a healthy person that doesn't have any pre-existing conditions can be a real good option from an affordability standpoint. And also for FMCA members specifically, a lot of these can be used around the country without any real limitations like you do with some of the ACA plans. So that's where some of that flexibility comes into play. The other side of it is if you went and did it on your own and you wanted things like vision, dental, critical illness, life insurance, you can't get it on the state or federal exchanges. That's not part of it. And you would have to go find all those pieces parts yourself. And if you go to a local carrier or a local broker, I should say, there's a good chance that they're not appointed with every carrier. They usually have a small stable of carriers. work with 2 or 3 that they get appointed with. We as a company invest the time not in just training for our staff, but also in the getting them, licensed for the states as well as appointed with all the carriers. So when you're talking to us, we have a complete solution as opposed to, hoping that the person you're talking to, or if you're doing it yourself, you're going to find the thing that works for you. The other side of it is we can do this in about 20 to 40 minutes on average. That time saving is huge. If you go and do this on your own, you'd be spending, we talk to people regularly that go through, hey, I spent 2-3 hours trying to do this myself, longer in a lot of cases, and they're just broken at that point. And we can do this pretty quickly. We can do it in 20 to 40 minutes on average. And that includes Medicare. I mean, so when we start talking to somebody, those tend to go a little bit longer, and that's more from the enrollment side of things. There's some different stuff that happens. So those tend to a little longer conversation if we go through a full enrollment, but time and resources and access, that's what makes us different. And we don't charge for our services for individuals and families. If we're doing a business solution for a business, there's some administrative fees, but that's, small and really nominal compared to even like traditional group insurance. So, there's no extra fees for using our services. You're not getting charged anything more. And that's one other thing. I know, Chris, you and I talked about this is, a lot of people come back, and I think you've mentioned this to me, where people say, well, I hope to get a discount, or I want a discount. There in health insurance, there aren't discounts. That's a kind of a misnomer when you hear, brokers have told you, oh, I'm going to give you a discount. They're moving you a different plan. Legally, we can't give discounts because it's regulated at the either state or federal level, and the prices are set by the insurance commissions in each individual state. There aren't discounting that happens, and it's a misnomer. And some brokers use that, but really you're getting a different plan. Your drug coverage has changed, your premium costs might go down, but your deductibles have gone up. Those are the things that you don't really notice or look at when you hear discount, as opposed to, I'm getting something for less, but you're also getting less.
I know you've kind of mentioned it a few times, maybe just in one spot here. Obviously, health insurance is the big thing, Medicare, but what are some of the other coverages you guys do provide?
Yeah, I mean, one of the big things outside of major medical, and major medical are those like ACA or Obamacare plans, or the short term or Medicare related plans. But we start looking at the supplemental coverages. So probably the most popular right up top are vision and dental. Those are the two biggest asks. Then after that, it's things like hospitalization, critical care, life insurance. Think of these kind of like Aflac type plans. Like if you're disabled, you can't work. Some of them pay out lump sums. Some of them are specific to if you get cancer, they're going to pay out lump sums, and it isn't meant to replace health insurance. They're there to help offset for things that you would have from an expense standpoint, either a deductible or any copays, those kind of things. And it can also help pay for your home, your rent, mortgage, those kind of things. So there's just a slew of other plans, and this is where that needs analysis comes into play. When we talk to someone, when we're asking them about their financial situation, their health situation, their lifestyle, there's reasons for that. One is if they qualify for subsidies, for example, if they're under the age of 65, we're going to make sure that they get those subsidies through the ACA. But it also is, we have another association we work with, and I think I may have relayed this to you at one point, Chris, but it's a tennis association, professional tennis, and we had a member who made a lot of money teaching tennis lessons, basically down in South Florida, close to $1 million a year. But their biggest concern outside of just having health insurance was they don't have basically workers' comp or anything along those lines. So if they got injured, what was going to happen? They needed income replacement, things along those lines, so that they could continue to have the lifestyle and pay bills and those kind of things. So those are some of the other coverages that we have within that health and life space.
And I do want to talk about real quick, we, obviously this pertains to our members, but we also have about 1,200 commercial members, and we have numerous members I know of that own their own businesses. Are you able to help those individuals out, those companies out?
Yeah, we do. And so we have really two ways we can go when we're talking to a individual that has, or member that owns a business or is part of a business. We can look at traditional group plans, which would be, what everybody's used to, where everybody has that kind of one size fits all approach, where it's a Blue Cross plan or an Aetna plan or something along those lines. But the one area that we've been spending a lot of time with and working with our members on is something called an HRA, which we're really excited about. This came out in 2019. Well, they'd actually been out before that, but they got kind of pushed to the forefront by the last administration. One of the few times that I'm going to say that the government did something right from the beginning. These are well designed, and what they're meant to do is they're a group plan, but you don't actually have insurance on the top anymore. And really, this is a way for the business, just like you do now, to help your employees pay for their health insurance. But the big difference is the employees have choice, which is something that you've probably heard me say many times, and members will hear that, is that it is about choice. I always, kind of look at, would you want your boss or the business owner picking your car insurance for you, or your homeowner's insurance, or your RV insurance? And most people are going to answer no. But the only reason you let that happen with your health insurance is because they're paying for it. Well, here we can kind of have best of both worlds, where the business is contributing pre-tax, just like you do with a normal group plan, but that employee now can use the money that they're getting pre-tax from their employer to then buy an individual plan. And that's where we come into play on this as well. So we build that plan out. We do all the work, the administrative side of things, but then we work with each employee one-on-one, just like we would with a member, to go through and find the best possible plan for them. And, if we have 10 employees or 1,000 employees, numbers really don't matter. We can work with just one W-2 employee to unlimited. But the idea here is that not every employee needs the same coverage as their coworkers. So this is going to get them that coverage that they need, that works for them, for making sure that they're have the right hospitals and the networks, the right doctors and the right prescription drugs, which is core to everything that we're doing. So yes, we have a solution for businesses, and they usually can save significant amounts of money by going to this approach. And it offers a lot more flexibility because you can have employees in multiple states. There's just so many ways to do this that you don't have the same constraints that you do with a traditional group plan, which we're really excited about.
Yeah. Okay. So when someone contacts you and you do this needs analysis, what are some of the things you guys ask and take into consideration when you're trying to point someone into what you feel is the best coverage for them? What are some of those things?
Yeah, so we have kind of a checklist of things that they're going to need, and this kind of goes to understanding where they're at. But we need to know who's going to be covered. If it's a family, who's going to be there. So husband, wife, kids, Social Security numbers, and then we're going to talk about the financial side of things. Where they're at from what their income is, and it's usually the whole family, and it's what is on the tax returns. So we don't get into any little nuances, but it's what's claimed. And the reason for that is for subsidies. So if they're looking at an ACA plan, that, is basically, if you qualify for a subsidy, which there was a major change made earlier this year, where they allowed, in the past, it was called a cliff. You would, if you made too much money, it just stopped and there was no subsidies for you. They've raised the subsidy levels, but they've also made it more of a gradual downhill. So people that didn't qualify for subsidies previously find that they do now in a lot of cases. And they also have the ability to, use that, it's basically a pre-tax savings, so instead of getting out your taxes at the end of the next year, you're getting that benefit up front. So, instead of costing, $1,500 a month or $1,000 a month, it might only cost you $300 or $400 a month, depending on your scenario. But that's where we're going to go through and find out your situation with your family. Who's going to be covered, ages, Social Security numbers, your income, and then health considerations. Excuse me. An ACA plan has to cover you for pre-existing conditions, so you can't be excluded for that. Some of the short-term plans, they're great options. They usually cost is less, but those are underwritten, and those plans would exclude you if you've had things like, say, a heart attack in the past, or diabetes, or cancer, or something along those lines. So if we find out that health scenarios there, we're not going to suggest or even recommend a short-term plan, for example, because it's not going to be something you would qualify for. So that's part of why we go through that. And then outside of that, doctors, what doctors do you prefer to go to? Hospitals, any prescription drugs. that basic information that I just kind of went through, that's the stuff that we need to kind of then, craft what is the best, couple plan options. Making sure, sometimes we're going to find that, you want to go to this hospital and these 3 doctors, and, we're going to see that this hospital and 2 of the doctors are consistent in all the plans. And there's that one doctor, and you find out it's a doctor you go to once a year. Well, we're going to have some conversations and make some recommendations at that point. It may be best to look at that doctor and say, you can either, go out and have out a network with that, or maybe look at a different doctor if it's, something you can only go to once in a while. So it's just understanding that, and, having those conversations quickly allows us to get to the, hey, here's the best 2 or 3 options for you to consider.
Okay. It seems like when I've kind of studied health insurance premiums, I'm going to focus on that. I'm amazed at how fluctuating the prices are, right? I mean, one carrier will come in 50% cheaper than another one. What kind of factors do these carriers look at when they give you a premium? What are kind of some of the main things they're taking into consideration?
Well, it's I don't know if it's really taken into consideration. It's what's in the plan. So, you have 4 in an ACA plan, for example. So this is independent of, say, a Medicare conversation. You have, for an under 65, you have typically bronze, silver, gold, and platinum. And that's where you can see some of that wide swing. Now, bronze plan is going to be your least expensive of all the plans, but it also means you're going to have some of the higher deductibles and copays, compared to, say, a platinum plan where your actual upfront payments higher, but your deductibles and copays and that kind of stuff are significantly less. And so that's part of that other thing, is understanding from a budgetary standpoint, your financial standpoint, what makes the most sense. Most people tend to lean towards a silver plan or a gold, but if you don't go to the doctor very often and you want to make sure that you have basic insurance, a bronze plan may make sense. And that's kind of what we're looking at. Now, it also goes back to what's included in there. And this is really, true within Medicare too. And you start looking at, say, Advantage plans versus, say traditional Part A, B and D and things along those lines. What are the extras that are included? The well person visit kind of approach. If you're talking about Medicare, do you have silver sneakers in it? Is that something you want to go to? Gym memberships from that standpoint. When you're in the under 65 set, there are things that on an ACA plan that has to be included. Well person, mental health, a lot of the women's health. Those are all things that have to be included there. But then it's the extras that they do, and we're starting to see the carriers adding more services or more things like telemedicine's a big thing right now. So a lot of the carriers are upping their game on telemedicine, which I think especially for your members is important. Where they could be in their RV and they could be halfway across the country talking to their primary care physician. So those are things that we're looking at as well, and that's where you can see some of the fluctuation in price. And then some markets, like I'll use our where we're based at here in Cleveland. You've probably all heard of, at least on some level, the Cleveland Clinic, which has a pretty good national reputation. But if you have an individual health plan and you want to go to the Cleveland Clinic, here in the Cleveland market, for example, you have only one carrier option. They have an exclusive agreement with Oscar. That is nothing we can do. That's just the relationship that Cleveland Clinic has with Oscar. So that's a little nuance, and that happens in some markets. There's some of that in Pittsburgh, for example, with Allegheny Health and the University of Pittsburgh Medical Center. They each own their own health insurance plans, and so they have a little battle going on in Pittsburgh. So there's some of these little market nuances that are out there that we try to understand and take into account. But like if you're in Cleveland and you're talking to us and you want to go to the Cleveland Clinic, you have one option. So and they tend to be a little bit more expensive too, but it is an ACA plan, so you can qualify for subsidies and things along those lines. But that's where we have to have some frank conversations with you to go through this.
Okay. You pointed out before, we have a lot of members on the road. Quite a few of our members are full-timers, so they don't have brick and mortar house. How, carriers there's no carrier that's nationwide, right? I mean,
Nope.
A lot of them are kind of regional. How is someone that's a full-timer, how are they paired up with a carrier if they don't have a.
Well, it is based on, I mean, I'm assuming, based on the conversations we've had and just knowing that, I mean, most everyone has to have at least a permanent address of some sort. And, I think I had emailed you at one point because we're seeing a lot of people come in from North Dakota. And, you mentioned that, there's a lot of people that are using that as home base, at least for, legal purposes and financial and other things. And that's such a scenario. It's going to be based on that zip code that you have, say in South Dakota, of what carrier options are available. And sometimes people have more than one. We've seen that a few times where somebody has their permanent northern address in Michigan, and then they have their permanent address down in Florida or something along those lines. So we can look at what are the best options as far as coverage. A lot of the ACA plans are they're not exactly an HMO, but they're kind of hybrid versions of that. So, if you want to go to your primary care with those, you typically would have to go to be in network in your hometown. I mean, that's just the nuance of those. That's why when we start talking to members of FMCA that don't have a pre-existing condition, that those what are called short-term plans, but they can be done for long periods of time, are some of the best options because those are portable around the country. There's some of the same things that happen with the Medicare plans. We have one through United Healthcare that they call it the Passport. And some of the members have taken advantage of this, but with that particular plan for Medicare, it's a Medicare Advantage plan. It basically follows you around the country. And so when you're using that plan, you basically go into the website on your phone or through the hotspot that they get on Verizon with you guys. And, you log in and you basically update your home address to where you're at. And you can do that throughout your travels. And so that then recognizes you as being in, Oregon or California or Texas or Florida, whatever. And that allows you to take advantage of providers in that new home network based on that type of plan. And that's where we also start, as I mentioned earlier, like the telehealth side of things. This is where some of that can, when you have an ACA plan, having access to telehealth can make up for some of that. And then, of course, emergency, if you're out on the road and you break a leg or, whatever, emergency services are covered. I mean, doesn't matter where your plan's based out of, that's always included. You're not going to pay out of network for emergency services. It's really those, those primary, when you have to go to your, get your annual physical, things like that.
Yeah. Something that I wanted to talk about, LIG, you guys recently rolled out a program called LIG Solutions RX.
Yep.
From what you've told me, it's a really interesting idea. Can you talk about it and how members can benefit from that program? Yeah,
exactly. Just to be very upfront, it is not an insurance product. That's something I want to stress. This is and why back this up a little bit. Say we call what we do the LIG Association Health Program, and this is part of the program. We're not. It's that choice thing we talked about before. But with this is not an insurance product, and it's a way to have set pricing on pharmaceutical medications, things that you would get at your normal pharmacy. But the advantage here is, unlike, say, a GoodRx, which is really just a coupon or discount card, if you've ever used those, you type it in or you go to their website or their app if you use that. And if you have one medication, you'll look and the prices are going to vary even from like company to company. You could be on, the main street in City, USA, and there's a Walgreens, a CVS, and a Costco within, quarter mile of each other. And the price could be, $5 to $20 difference between all three of those for the same medication. Here, it's set pricing. There's 900 medications that are in the formulary, meaning there's 900 covered drugs that are going to be a set price all the time. If there's something that's not in the formulary, they're going to look at it and either see if there's an alternative, or if they can get it at their cost and it's going to be less than what you would have, they're going to go that route for you. But of those 900 covered medications, they usually fall into like 3 or 4 categories. And so you have what are our immediate need. And that's something like an antibiotic, a Z-Pack. I don't know if you've ever gotten a Z-Pack, Chris, but even with insurance, those things can be rather pricey at times. A Z-Pack with this program, when you're a member, it's a paid, like a subscription type program. But the actual medication, once you're a member, is for that Z-Pack, it's $5. and you actually go to a local pharmacy. So they have 64,000 pharmacies across the country that you can just walk into with your membership card, with a valid prescription, or have a doctor send it to, whatever pharmacy, and you're going to get that for $5 for things like that immediate need. Then you have things that are chronic, medications that you take every month, say cholesterol medicine, blood thinners, stuff along those lines, things that you have to take every month. Those are done as, and again, $5 for most of those. And that's $5 per month. So it's a mail order scenario at that point. And they actually mail them to you, and it's done on a 3-month supply. So if it falls within the formulary, they're going to send it to you. And if you're moving around, you just update where you're going or where you're going to be at, and they'll make sure they get it to you. And then they have over the counter as well. So if you're looking for things like Tylenol and Advil and vitamins and things along those lines, those are typically, $3 to $5 on average for those. And if you're getting another prescription, like have a typical mail order or one of those kind of things, they'll include those at no extra cost. As far as, you have to pay for the Tylenol, Advil, whatever, but they're not going to charge any extra shipping fees. If you just need that and you don't want to go to your local pharmacy, they'll charge a shipping fee on that. But on the others, like your heart medications, your cholesterol things, there's never any additional fees outside of that $5 per month. So $15 for a 3-month supply. The one part of the program that I'm excited about, but when I saw this part, it really made sense to me. It's a diabetic program. And so if you've never known anybody that's diabetic, you've probably heard that things like the test strips, the Lancets, and even insulin are very pricey. And one thing that I'll point out in everything here is they use US-based manufacturers for all their medications, including their insulin. And the insulin is $19.88 a vial. So if you have a valid prescription for insulin, it's $19.88. Now you actually go to a Walmart pharmacy. And the reason they use Walmart is because there's really a Walmart just about everywhere. I think if they had Dollar General pharmacies, they would probably use that because there are probably more Dollar Generals than there are McDonald's in the world at this point. But the idea is that there's a Walmart just about anywhere. So if somebody has a valid prescription for insulin, the idea here is to make it accessible and easy to get. Now, things like test strips and Lancets, which can be rather pricey, these are typically under $10 for like a 30-day supply that if you're taking it like if you use one a day, but it's like 15 for, I think, like if you're using twice a month, it goes up, but it's so much less than you would get just buying it yourself or through insurance. Now, this doesn't replace insurance. Personally, I have a few medications that I take that I get through this program. One that I can't get through the program, and I actually go to my local pharmacy. But by doing this, I actually cut my medication costs in half. So for an individual, it's $10 a month to join. It's $15 for a couple, and it is $20 for a family to join. And that's unlimited. So, if you take I usually recommend it if you're taking something on a regular basis. This is a very affordable program. We have one of our association executives who is spending about $900 a month on medications. Medicare took care of the one medication, the most pricey one, which we found out cost was $1,200 on. But with her Medicare Part D, she was getting that for $325. Made absolute sense for her to get it through her Medicare. The other medications that made up the bulk of that rest, that was almost $900 a month, came down to $5 a piece. She ended up taking her whole entire medication cost down to just about $400 a month with her her own personal individual subscription to this thing. So she went from almost $900 down to $400 with this. Now, doesn't work for everybody, and there's really easy when you go to the LIG Solutions RX.com webpage. You can type in your medication, either the generic name or the trade name, and it'll tell you if it's part of the regular formulary. If it's not, we can actually get them to quote it and see if it's going to come in at a better cost, their cost versus what you get with your insurance. But most of the time, you're going to find that most of your medications will be here. There's always going to be those one or two, if they're really new medications or something, the latest, greatest, that may not be covered yet. But, that's where we'll have conversations with you, or our pharmacist will. And it's a legitimate, real pharmacy. They actually have a brick and mortar building based in Akron, Ohio.
Yeah, we'll drop the link to that so people can check it out if they're interested to see if it'll save them some money. We'll drop the link to that in the chat. So again, the reason why I thought the timing was perfect is because open enrollment is coming up very, very soon. What are some of the dates members need to be aware of as they're
yeah, I
deciding
mean,
what to do?
we're in open enrollment, like middle of it. Right now, Medicare, which is the annual enrollment period, started on October 15th, and it runs through December 7th. So we have 5 days left for Medicare open enrollment or annual enrollment period. So if you're looking to, either get it for the first time or to make any changes, this is the time to do it. So our team is available. We have people here right now, basically 8 to 8. As we get closer to the end, we'll have those hours extended, but we have, people available, Medicare agents to help at any time. You can either, form fill off of the webpage that we have for FMCA or the dedicated phone number. And that's, easy to, use to get a hold of us, call in direct, or to request a call back. If you're under 65, you have a couple dates to look at here. You have the open enrollment period started on November 1st, and it runs through January 15th of 2022. But the important thing to know there is if you want coverage and have it in place for January 1, you have to have that coverage purchased by December 15th. So we have, just not even 2 weeks yet to make that happen. Now, if you got it on the 16th or the 17th of December, your coverage won't start until February 1st of 2022. So if you wanted to have an under 65 plan for major medical in place by January 1 for somebody that's under 65, December 15th is that deadline date. If for some reason that doesn't really matter to you, you have until January 15th. Just know that won't kick in until February 1st of 2022. And we're open now on weekends. We have agents available throughout. And as we get closer to that December 15th, and then also that January 15th, we'll have extended weekend hours, beyond what we're doing right now.
Yeah, I know you guys are busy. Absolutely. I'm sure it's insane right now during this time. Are there any cases where members can get access to major medical, for example, outside of these open enrollment periods? Is there anything that triggers to add on coverage?
Yeah, yes, it does. So you have what they call a qualifying life event. And if we'll talk, kind of separate all three elements of kind of where we're at, where we're talking about, people that are under 65, people that are over 65, or a business solution. These are handled differently. If you're under 65 and you are looking for coverage, there are options throughout the year. They're a little more limited outside of these enrollment periods as far as what's available if you don't have a qualifying life event. Now, qualifying life event is something that would trigger you, allow you, if those happen, I'll explain what those are in a moment, to gain access to the Affordable Care Act plans at any time. What typically those qualifying life events are is if you've had a job change, you've gotten married or divorced, birth of a child, you've moved, and it's not just like permanent address move, not like you've moved your RV from Florida to Texas. I mean, they're looking at like permanent address change, because we actually had somebody ask about that at one point, a member, and it is that what is considered your permanent address. The other is becoming a naturalized U.S. citizen. There's a few little triggers that'll come in that are kind of unique outside of that, but those events will allow you to get access to any ACA plan at any time of the year if something like that happens. If you're not going to have a qualifying life event, you've decided, hey, I don't have insurance, now it's time to get it, and you don't do it during open enrollment, we have the short term and some other options that are available to you to basically use as a bridge to get you over to the ACA open enrollment period. Or again, if you're relatively healthy and you don't have any pre-existing conditions, those quote unquote short-term plans can be used for longer periods of time. You can actually have the same plan and renew it for up to 3 years right now. You can have it as short as 3 months, but you can have it as long as 3 years, depending on your scenario. For Medicare, you do have qualifying life events. So like again, the other side of it is on Medicare, if you're aging in, so if you turn 65, that's an automatic trigger to get into Medicare. And there's some steps that you need to take to get into Medicare or to access that. Basically, you have to enroll through Social Security, and I can talk about that if you'd like. But the other side of it there is during open enrollment, you can get anything at any time, but they have a supplemental enrollment period. If you already have an existing plan and you need to make a change, basically you find out after January 1st that your doctor is no longer in the network of the plan that you have, you can make changes in the month of January, February, and March. We can help you do that. And these are typically for Advantage plans. That usually doesn't impact, say, like if you have just Part A, B, and say D, for example, that usually aren't impacted by that. But there are some things that they've built in to take into account that things change a lot after the first of the year. So that's kind of that. Now, the third area is business coverage. If we're looking for coverage for a business owner, for their employees, that can be done at any time of the year. That in itself triggers a special enrollment period. So we can do that at any time of the year. So if you have never offered a plan before to your employees, or you want to make a move from a traditional group plan to something like this, or make a change in general, that can be done at any time of the year.
Okay. I don't know if I really have anything else, Tim. Is there anything else I didn't ask you to touch on that you wanted to mention?
No, I think the only thing that I saw a comment pop up on this, somebody asked about the link. I think let everybody know that it's ligmembers.com/FMCA. That is actually the link for accessing the organization's page on that. That just saw it pop up, or it should be popping up for everybody in a moment here. But ligmembers.com/FMCA. That will get you access to the form fill where you can fill that out. That'll get right into our agent team. They'll be contacting you back, or there's a direct dial phone number on that page as well that you could click off on a mobile device or whatever, and that'll take you right to our agent team. Now, understand, as Chris, you pointed out, and you were absolutely right, this is our busy time of the year. So, you may be in a scenario where you're on hold for a little while. It gets, everybody typically waits to the last minute, just human nature. And, we're not ignoring you, but, if you do call, they may, one of our customers care team members, they may ask for your information to have somebody call you back. Just know that that's a possibility. It is busy. I can tell you that there are times of day that are less busy. So early in the day, that 8, 9 o'clock to 10 o'clock range is usually slower. Same with, like, say after, and this is, I use Eastern times here. And then say like after 6:30ish, after that, things slow down a little bit too. So if you're looking for a good time of the day, weekends are pretty, they'll get busier, but this weekend, I don't think you'd have a lot of issues. We have hours on, Saturday and Sunday. So, you have timeframes, but my best advice would be try earlier in the day or a little bit later in the day, and you probably have the best chance of getting through without any issues. Now, as we get closer to the 15th, everything's thrown out the window.
Yeah, exactly. Do you take a nice vacation on the 16th?
No, because we're going all the way now until January with open enrollment. So I'll take a couple days at Christmas and that kind of thing. I actually get to drive my daughter back to Colorado this year in that week between Christmas and New Year's. So I'll be on the road.
Awesome. Well, I don't see any questions in the comment section. So I guess we did a good job, Tim. No one has any clarification needed.
That's good. And if they have questions, I can give you my email address. I'm happy to, communicate. And a lot of times it's, if you have a question, I'll have to direct you over to, one of our agents if it's very specific about a plan or policy. But, I have no issues with anybody emailing me. My email address is my first initial T, my last name, McNichols, which is, here on the screen, McNichols @ligsolutions.com. And, if you have questions, feel free to, send me a note, and I'll make sure we get it over to our agent team as well. But your best bet, if you're, looking to get a quote or you want to talk to one of the agents about, specifics on plans, is to, go to the ligmembers.com/FMCA or dial the toll-free number that we have on the webpage and is scrolling on the screen now.
All right, perfect. Well, Tim, I know you're busy. We appreciate you coming on to talk about the program, and good luck the rest of this busy period.
Yeah, I really appreciate. I mean, we've really enjoyed working with you and your team, and talking with the members. They're great, and we're very jealous of a lot of them when they tell us where they're sitting at and they're looking out on the ocean or the beach, or not in an office. So I can say that we're usually pretty jealous when we're talking to your members about what they're doing and where they're at, and we're sitting on the phones or sitting in our offices. So just remember that we are very jealous.
Yes, I can sympathize with that.
For sure.
Okay. Well, thanks again. We will do this again next month. Guest to be determined. And before I sign off, so I don't get in trouble, happy birthday to my youngest Brody. He turns 4 today. So happy birthday, buddy. Love you. Well, thanks, Tim. I appreciate it.
Thanks, Chris.
We'll catch up.
Have a happy holiday to everybody, and enjoy the time, and hopefully everybody gets to spend some time with their family and friends and loved ones and all that. So enjoy the holidays. Merry Christmas, Happy New Year's, Happy Hanukkah, Kwanzaa, all the above.
Well said. Thanks, guys.
Thanks, guys.
Next time. Thank
Bye-bye.
you.